Welcome to North Star Physical Therapy Podcast. I'm Dr. Shirlea North, and with over a decade of clinical expertise in the areas of pelvic floor conditions, lymphatic conditions, and chronic neurological diseases, I have a wealth of medical knowledge that I want to share with you all. In this podcast, I will answer the most common questions I receive from clients, family members, and fellow clinicians. Our purpose is not only to answer questions, but to educate you so you can make the best decision for your optimal health. This podcast is perfect to listen on your way home from work, while you're on your daily walk, or just taking 15 and 20 minutes for yourself. Again, welcome to North Star Physical Therapy Podcast, and get ready for us to guide you to optimal health.
Hi everyone, this is Dr. Shirlea North from North Star Physical Therapy again, and welcome back to all those that have listened to me before, and hello to anybody who is new. And so recording this episode within the month of November, and we all know that November is the awareness for men's health. So even though I'm a very inclusive physical therapist within pelvic health and lymphatic health, I want to really showcase this podcast for those that have been assigned male at birth and that have male genitalia. So penis, testicles, scrotum, those organs, okay? So please know that we're going to be sensitive and aware to different genders and identities and orientations. But for the purpose of this podcast, it's just more for that general awareness that those with a penis, those with scrotum, testes also have a pelvis, and they also need to be aware that they can also develop pelvic pain, urinary incontinence, constipation, those kind of things that are maybe we associate with more those of the opposite gender and sex, and with those that were assigned female at birth, but men have pelvises too. So we just want to broadcast out there with this podcast that you are very much deserving of pelvic health, physical therapy, and assistance in this realm. So here's a little intro to men's pelvic health. So just like how I mentioned, all bodies have pelvises. So no matter what the external or internal genitalia or tissues that are present, there are muscles, there are ligaments, there are tendons, there are nerves, there is a blood supply, and everything needs to be working together to optimize its function so that someone doesn't have pain in this area, someone doesn't have any urinary incontinence or leakage, or that double dribbling, after you finish avoiding, or how about the urgency, or even the stream is hesitant, right? It's hard to initiate the urine flow. Some other symptoms within pelvic health that we see with the male genitalia too is also constipation or even fecal leakage. Pelvic pain is also very much present. So whenever sexual intercourse or penetration, or even just the intimacy, that sensation of the tip of your penis, or even with deeper penetration, is there discomfort. So it isn't all just about the female body, but we want to encourage guys to please tell that to your providers or seek out pelvic floor physical therapy so that you can discuss these issues, because that's a quality of life thing. Pelvic floor physical therapy isn't just for the postpartum mom. It is also for you too. We want to lift up the awareness and put it in your face, especially during the month of November, right? We want to make sure that you are aware that you have a pelvis. We want to make sure those muscles are flexible and strong when they need to be. We want to make sure your urinary function is okay. There's no hesitancy, there's no leakage, there's no start-stop to the flow. We want to check out, what's your position within that activity. Are we standing? Are we sitting? Is our pelvis in an optimal alignment so that the muscles can relax and allow for that full void? Are we having some residual urine there as well? So we want to make sure urinary function is going okay. Bowel function, again, we want to make sure there's no constipation and that there isn't any maybe fecal leakage that may be going on when you're exercising or after you're done exercising or during a stressful, season of your life. You too go through hormonal changes as you age. And so even though we are making awareness of the perimenopausal and postmenopausal woman, men also go through hormonal changes and reduction in testosterone and what that can do to those pelvic floor tissues. Okay, so we're looking at the positioning of when you're having a bowel movement as well. Are we having flexibility in those tissues? Are they so uptight it's very hard to evacuate a stool? And do you find yourself really bearing down? And now there's a pressure management issue. And oh yeah, I also have a hernia. Wait a minute, is that related? Yes. So we want to make sure that your pelvic positioning is optimal, that your breathing pattern is optimal during that time as well on the toilet. Now we bring ourselves into the sexual function of the pelvis. And like I alluded to a little bit earlier, whether you are being penetrated or you're being the penetrator, those tissues can become really irritated or sensitive. And is that what's happening for you? Is it upon immediate penetration? Is it more in the deeper penetration? There are different nerve endings at the tip of the penis versus at the shaft or the base of the penis. And then for those that engage in anal sex, which is completely normal for no matter any sexual orientation, cisgender, LGBTQ community, it doesn't matter. Anal sex is anal sex. But if you are being penetrated and is extremely uncomfortable or could cause maybe some anal fissuring going on, things like that, that's a problem. We want to make sure that we can maybe have a good pelvic positioning, that we are down training the pelvic floor muscle during that act. Maybe you're the penetrator and the sensation at the tip of your penis is hypersensitive and it's very uncomfortable to do that. Or maybe you're engaging in some foreplay with your partner and it's extremely sensitive, or we have difficulty with arousal. We have difficulty with attaining an erection and maybe sustaining an erection, or is there premature ejaculation going on? So yes, within the pelvic physical therapy realm, there's so many things that I just listed off that is something that a pelvic floor physical therapist can work on with you. And you're not alone. And that's the other thing too. I think society has boosted up this machismo and bravado, kind of a guy and like nothing's wrong with me and all that. It's like, that's just simply not true. And so we need to be okay to mention these things to your providers, so that way they can appropriately screen and treat you and not just hand you a pill, the little blue pill to increase your erection because that's your one and only symptom. Be an advocate for yourself and know that it's more than just medication. And honestly, having erection issues with the very small vasculature within your penis and within the genitalia right there, it's very, very small. So if we're having difficulty with either attaining or sustaining an erection, that might be a little sign that what's going on with your overall cardiovascular health, right? And so that might be a little trigger, like, you know what, I maybe need to go see a cardiologist as well. It's like a little screening tool, for us. So I often ask men that have that issue, when was the last time, do you have any cardiac history? Is there anything within a familial history? Is there anything that you are currently being treated for like blood pressure or anything like that, or heart rate? Because that can be a little sign for us that maybe something else is starting to kind of creep in, and this was just your body's first sign of that. So there are a lot of things that are interrelated within that. So I just went over, urinary symptoms, bowel symptoms, and sexual symptoms. Some other symptoms that a pelvic floor physical therapist can work on that is connected with the pelvic floor musculature and soft tissue are hernias. Guys can also get diastasis recti, right, which is often associated with those that are that get pregnant. But men can also develop that kind of separation or reduction in tension of the soft tissue between your abdominal muscles, your six-pack abs, and then let's say you do a sit-up or a crunch, and you see that kind of bread loaf presentation in the middle of your stomach going from your ribs down to your pelvis. So you kind of see this hump or doming. If you see that, guess what? We have some diastasis recti. And so that can be a pressure management issue. Think about it. If you have a loosening of soft tissue in your abdomen that makes it hard to appropriately manage your pressure that needs to go down to the pelvic floor, let's say you're constipated and now you're trying to push through that pressure management issue. And let's say because there's some looser connective tissue above, your pelvic floor is compensating underneath, so now it's really tight. So we're trying to push through some weakened muscle, with a weakened muscle through a very tight muscle group, and now we're constipated. And now maybe they develop a hemorrhoid or an anal fissure because of that. So can you see that things are interconnected with just one bowel symptom? But then when we take a step back and look at the bigger picture, we notice, wow, our breathing management isn't really appropriate and is just acting like a piston straight down to your pelvic floor. And we might have some low back weakness, some glute weakness, some hip weakness. And so our pelvic floor is just compensating for all of that weakness, and now it's really tight. So we definitely, as pelvic floor physical therapists, take a step back and look at the big picture. How is your rib mobility? How is your spinal mobility? How is your hip mobility? Oftentimes, men can be really, really tight. And let's say we are also stressed out, and now our nervous system is tapping into that muscle tightness and tightening it and guarding it even more. And so it's just this vicious cycle. So I want to empower you guys that please talk to your providers. And if anything, hook in with your pelvic floor physical therapist nearby, or even myself. I offer virtual consultations to go over these little symptoms and to help guide you on, should you pursue that and move forward? Should we look up a local pelvic floor physical therapist for you? Or we can even guide you even virtually of how to manage your symptoms and different tips and tricks and techniques and maybe stretches or exercises. I often encourage those to also seek in-person treatment though as well, so that we can be a little bit more hands-on in our approach. So if there is any manual therapy technique to help relax musculature or help with joint mobility, we can certainly provide that and then give you the tools so that way you can maintain that at home and reduce your symptoms. So there's a lot to be said there, but for the month of November, guys, I encourage you to take a step back, realize that things can be interconnected, and I give you hopefully the confidence and the courage to talk to your provider about or seek out a pelvic floor physical therapist if you have any of those symptoms, or if even your dad, your uncle, your brother, a friend, talk to them. Make this more of a normal discussion, that there is not a taboo anymore with pelvic health. All right, and until next time, guys.
Thank you all so much for listening to North Star Physical Therapy Podcast. Continue to follow me on Facebook or Instagram at Dr. Shirlea North. Check out my website at www.northstardpt.com, or I encourage you to email me any other questions about these topics, and it can be featured at a future podcast at snorth@northstardpt.com. Again, thank you all so much, and thank you for letting North Star Physical Therapy be your guiding light to your optimal health.